For this next test, which is known as the pelvic rotation test, there's a few concepts you want to consider when you do this test. Let me just give you an idea first of all, okay? So if I ask my patient to place their arms across your chest, please, and then I'd want them to slowly rotate as far left as he can, okay? And then you were just looking at how much rotation he has, and then if you rotate to the right, he is a little bit limited to the right, so he's a bit stiffer going this way. Now, obviously, there is movement within the thoracic spine, and people think, well, maybe it's a thoracic spine issue. Okay, but then if I get him to rotate again like this way, okay, you will notice that one foot, okay, will pronate, one foot will supinate, one hip will internally rotate, one hip will externally rotate. So it's naturally, it's the foot positioning, it's the hip positioning, but also as he's in this position here, the right side has gone more anteriorly and the left side has gone more posteriorly. And when he's coming around this way, the right side now is coming more posteriorly and the left side is coming more anteriorly. So if we look at it, say, purely from a pelvic positioning, so in my thought process, okay, because there's one author that considers it to be slightly different. So my thought process would be, if the right side is already anterior, okay, he's already in a position, then going to the left will be easier than going to the right because he's already there. However, the other author states that if you've got a right anterior, basically when you come to the right, it comes to neutral and then he's able to continue, so he has more right rotation, even though he's got a right anterior rotation, okay? So, but the idea of a test is, you know, it just gives you a bit of information that you can use in conjunction with other testing. But for me, if the right side is anterior, I do believe that the left rotation seems to be easier than the right rotation, okay? So just bear that in mind when you are. You'd obviously want to be looking at the position of the foot, position of the leg, any hip pathologies, or any even spinal pathologies within the thoracic spine. So that would be known as the pelvic rotation test, even though it compromises many other aspects of the body. Thank you.